My name is Matthew Kaufman. I'm a plastic and reconstructive surgeon at the Institute for Advanced Reconstruction. Occipital neuralgia can present itself in a variety of ways. One of the typical ways or presentations that we see is someone that was in an accident, such as a car crash or a fall, after which time they start getting pain in the back of their head, running up the back of their head. And the pain is generally always there, just at different intensities. So some days it's a 10 and some days it's a 5, but it never really goes to a 0. That's a typical way, although not every patient presents that way. So for occipital neuralgia, many patients say, why should I see a plastic and reconstructive surgeon? And generally we do not want to be the first person to see these patients. We want the patient to have seen a headache specialist or someone that can evaluate them, properly diagnose them, and at least get them started on the first-line medical treatments or first-line therapies. If we can really determine that the occipital nerves are the source of the problem from nerve compression, then we have some potentially very good surgical treatments to help alleviate or cure the problem. You may see it on the internet as trigger point deactivation surgery is another term, but we basically call it occipital nerve decompression surgery. And essentially that's a surgical procedure where we're operating on the occipital nerves and trying to relieve the underlying cause of the problem, which is nerve compression from scar tissue or from the results of inflammation. So it's a whole process to go in and to do this surgery to relieve the compression and allow the nerves to heal. And if the nerves heal and reset themselves, then often the pain goes away and the patient can be relieved of this debilitating pain condition. It's roughly about a 3-hour surgery to do both sides. That means if we're dealing with the right and left occipital nerves. The recovery process after the surgery, the first week is very limited activities, some dressing changes, some drain care. After that, it's regaining more day-to-day normal functioning, and after 3 weeks, going back to work, resuming some light exercise, and then usually at a month, sending some patients for range of motion physical therapy, because for the first month they're not moving their neck or shoulders very much. So after that time, we want them to start to regain or recover their normal or range of motion function. Many of these patients are so on edge because of the fear of the pain coming on. So even if they wake up on a particular day and the pain isn't so bad, they're always so nervous and worried that if they move the wrong way or do the wrong activity, even going out and gardening, be one example, that the pain will flare up and they'll be out of commission for the rest of the week. So not having that fear anymore allows them to go out, not having the pain come on at all, allows them to return to a normal life, a functional life, go back to work, go back to social interaction, and take someone that has no quality of life and terrible pain and put them back in a normal functioning state. It's very rewarding.